I cut a digital health startup's acquisition costs by 80% without changing their spend. Here's how. First things first, I'm Grace, the marketing anti-guru. I've worked inside of startups for 20 years, and for the last 3.5 years have been building my own consultancy. So this client had just raised a Series A. They wanted to invest in a smarter marketing strategy, but did not want to rush into scaling their paid spend, which is like my favorite type of client and so smart. So my guiding principle is what can be measured can be changed. So one of the first things I did was dig into their funnel and see where users were currently dropping off and just the rigor that they were tracking each funnel conversion step. We cleaned up their funnel steps and made sure that every step was being tracked as a conversion event in their respective ad platforms. They hadn't been very bullish on Google in the past. They thought their niche needed more context, needed more discovery, and therefore lent itself more to meta ads than Google. And also they just hadn't had much success running Google in the past. In my consultancy, we don't isolate tactics, and we often want to retry things that were tried previously that maybe just weren't executed as well as they could have been. So we retested Google Ads, knowing that now we could read all of these signals more clearly. Alongside that, we refreshed all their meta creative to directly address the psychological points of friction we were seeing blocking a lot of their prospective patients. The refreshed meta creative strategy brought more relevant audience to the top of the funnel. And then the new Google Ads helped convert the higher intent ones. We ran everything at the pre-raise level just to see if there was signals of traction. At the same time, we turned out much more organic content. We refreshed their partnership angles and just generally gave a new lens or filter of who some prospective partners could be on the consumer side. We also improved their onboarding flow to, again, speak directly to these friction points that were stopping prospective patients in their tracks. So this was informed by not only the funnel data, like where people were falling off, but also from a survey that was implemented to follow up with folks that dropped off in the funnel. P.S. I love a survey for leads that don't convert. One of my favorite things, especially for a new brand. So over 5 months, with a combination of these tactics, we were able to bring their CAC down by 80% without a new dollar spent. This particular startup was not interested in scaling their consumer spend much above what it had been because they had other areas that they were more bullish on in terms of payer relationships, partnering with larger medical institutions, etc. So they always kind of wanted to keep their consumer marketing budget tight and efficient. And we ended up working with them for close to 2 years, one of my favorite clients to date. And I think how they thought about their whole marketing mix was so smart. Anyway, I just wanted to give a little peek into the actual work I do in case there's a nugget that inspires you to take a closer look at your funnel or your business or your tactics and see how they can maybe be working together in a more efficient way.